Addiction, contrary to some beliefs, is not a mark of weak willpower or moral failure. It is a disease that impacts the brain's structure and functionality. When someone is addicted, they have an intense focus on using certain substances like drugs or alcohol, to the point that it takes over their life. Alcohol and drugs are chemicals that interfere with the brain's communication system, disrupting the way nerve cells send, receive, and process information. These substances imitate the brain's natural chemicals, overstimulating the reward circuit, which results in what we perceive as a high. Unpacking these aspects will enable us to understand why breaking free from addiction is not as straightforward as it is often portrayed. One common misconception about addiction is viewing it as a sign of moral failure, not realizing it is a medical condition just like any other disease. Like heart disease or diabetes, addiction is triggered by a combination of behavioral, environmental, and biological factors. This misconception often leads to shame and stigma, which can discourage individuals from seeking the help they need. The reality is that addiction isn't a character flaw or moral failing, it's a chronic disease that needs medical intervention and consistent support. By accepting this, we can discard judgment and instead promote empathy and understanding. The belief that a person must hit rock bottom before they can effectively seek help for addiction is a damaging misconception. This belief allows the disease to progress, often resulting in severe consequences before intervention occurs. The reality is, early intervention is key in treating addiction. Similar to other chronic diseases, early diagnosis and treatment increase the chances of successful recovery. Waiting for rock bottom can risk an individual's health, relationships, and life. The critical point to challenge this myth is understanding that you don't have to wait till things get worse. Seeking help at initial stages of addiction not only produces better outcomes but also prevents further degradation. Another damaging myth is the belief that addiction treatment should be punishing. This notion originates from antiquated views that addicts are morally corrupt and should be punished for their wrongdoings. Modern understanding of addiction, however, underlines the importance of compassion, empathy, and support for those battling this disease. Structured support systems, professional guidance, and comprehensive medical treatments are reported to yield better results. Punishment-based initiatives often fail because they deepen feelings of shame and guilt, further aggravating the problem. The benchmark of the recovery journey is not punishment, but understanding, acceptance, and constructive help. The misconception that only certain types of people become addicts is not only stigmatizing but also incorrect. Addiction does not discriminate, it can affect anyone regardless of their age, wealth, education, societal status, or race. It results from a complex interplay of genetic vulnerability, environmental factors, and social pressures. Presenting comprehensive statistics and studies show an overwhelmingly clear picture: addiction pervades every stratum of society. Understanding this is critical since the stereotype that addiction only affects a certain type of people further perpetuates discrimination and inhibits those who need help from seeking it. In conclusion, it's imperative to dismantle these prevalent myths about addiction. These misconceptions not only reinforce stigma but also inhibit effective treatment efforts. Addiction is a complex, multifaceted disease that requires a comprehensive and empathetic approach for successful recovery. By breaking these stereotypes and spreading scientifically accurate information, we can foster a society that treats addiction with the seriousness and compassion it deserves. This paradigm shift in understanding is instrumental in creating supportive environments for those battling addiction, promoting their recovery, and recognizing the dignity and humanity inherent in every individual irrespective of their struggles with addiction.